Hello and welcome to this edition of NCLEX Boot Camps on the Go. My name is Susan Griffiths and I am one of the NCLEX Success Specialists. During this presentation and our time together, we're going to be talking about the category of psychosocial integrity. So let's get started. In this session, we are going to be examining the nurse as the PN or VN, the nurse's role in supporting clients facing emotional, mental, or social health challenges. We're going to be exploring therapeutic communication, mental health care, abuse prevention, and more. These are all aligned with the NCLEX PN priorities. The psychosocial integrity domain evaluates your ability to support clients experiencing emotional distress, mental health conditions, or life-altering stressors. It includes recognizing signs of abuse, crisis management, end-of-life care, and promoting effective coping strategies. It is very, very important to your client's safety and for you as a nurse to recognize signs of physical, emotional, or financial abuse. Be alert for signs like poor hygiene, weight loss, or withdrawal. Make sure that you're always providing a safe environment. Report suspicions. You don't have to prove anything. You just have to have the suspicion that something is going on, and make sure that you're supporting your clients through emotional recovery. Under the category of behavioral management, it's going to talk about things such as observing the client mood, the appearance, and behavior. You're going to use positive reinforcement, set limits, and use therapies such as validation or reality orientation or reorientation. You're going to make sure you support caregivers and evaluate the effectiveness of those behavioral strategies. We know that there are both positive and negative coping mechanisms. It's important to recognize each of those. You're going to collect data on how your clients cope with illness and stress, whether they cope in a positive manner or a negative manner. Provide support for role changes, especially after a traumatic life event. Reinforce therapeutic strategies and assist with maintaining independence, especially after an unexpected change. Maybe they've had an amputation, maybe they've become paralyzed, maybe they've had an altering in their body image, so a mastectomy, or now they have a colostomy bag, anything like that. It is your job to make sure that you are maintaining mental health in addition to those physiological changes that you're going to see in your clients. When the test plan moves on to crisis intervention, this means you as the nurse need to identify clients in crisis, especially those that are at risk for self-injury or violence. You're going to use de-escalation and provide access to crisis resources. Obviously, always report any changes in behavior and guide your clients towards recovery. Cultural awareness is one of the most important things that you can do when caring for your client and showing that your client, you see them as a person and not as a room number or a diagnosis. You need to always respect your client-reported cultural practices, especially when planning care. So never make assumptions. Do not create a cultural bias in you look this way or you sound this way, you speak this way, so you must be this way. Never, ever, ever do that. Always go on what your client reports as their cultural beliefs and practices. Understand how the beliefs influence the treatment choices and be sensitive to spiritual, gender, or cultural identity. That doesn't mean you have to agree with them. It means you have to understand them and honor them as their choice. When talking about end-of-life concepts, that can be very emotional for everyone. So the first thing that you need to do is recognize in yourself how comfortable you are discussing end-of-life concepts with your client and their families. You need to support clients and families facing end-of-life issues. Address their concerns like fear and loss of control. Reinforce the education that they've already received and be there to provide emotional care throughout the grieving process, remembering that grief has multiple different avenues. It can be anticipatory grief. It can be after a loss. Anything that has to do with the loss is going to have a grieving process, whether it's health, finances, maybe a life situation. All of those are going to involve some sort of grief. You need to be able to recognize both normal and abnormal grief reactions and support clients through those stages of grief, stages like denial and anger, acceptance, depression. All along the way, you're going to provide access to counseling and support groups as needed. As I've already said, recognizing the use of defense mechanisms, so very important. Are they using positive or negative defense mechanisms? All of them will use, and we all do, some sort of defense mechanism. But identifying symptoms of mental illness, sensory alterations, or cognitive decline is very important, not only to recognize them, but to recognize them early so that you get the most appropriate help for your client as soon as possible. Always remembering to promote independence, self-esteem, and adherence to treatment. That doesn't mean we have to be very strict and rigid, but we continue to reinforce the education about following the treatment plan and or not following the treatment plan and the consequences of both. If you have a client that is not following their treatment plan, find out why. It might be something as small as they just didn't understand it, or it might be something as big as I can't afford it, or I don't like the way that it's, medication is making me feel. But explore those reasons so that we can get that client the most help possible. Not only are there cultural influences and awareness that you need to be making sure that you pay attention to, but also those religious and spiritual influences and how they impact a client's health. Very, very important. So understanding the client's spiritual belief is going to help you provide the most appropriate care for them. Respect their needs. Make referrals when appropriate or call in people when needed, and make sure that you support their spiritual well-being all along the journey. Sometimes your clients will have sensory or perceptual alterations, things like hallucinations and delirium. You need to recognize those and ensure that your client can communicate their needs. Sometimes it's from medication, sometimes it's from the disease process itself, sometimes it's from just being in the hospital for an extended period of time and things just don't line up any longer. Recognize all of those possibilities, figure out what's going on, and help your client all along the way, providing safety and reassurance. We never reinforce a hallucination, but you want to make sure that your client feels safe and that you are there for them. Identify those stressors and reduce them as much as possible. Reduce environmental triggers and encourage stress management. These are techniques like deep breathing exercises and journaling. They may not know how to effectively reduce their stress in the hospital setting, especially. So give them those tools so that they can be in control of as much as possible. That will naturally help reduce stress. In order to be able to recognize signs of substance abuse, withdrawal, or toxicity, you have to know those signs. So make sure that you are educating yourself very well on all of the signs of potential substance abuse, withdrawal, or toxicity. You're going to provide care and support group referrals as appropriate, and then reinforce those treatment plans for long-term recovery success. Making sure that they have everything that they need, not only the referral to the support groups, but also can they get there? Do they have transportation? We can help arrange for that through social services, and also the financial wherewithal to be able to go to those. Maybe they have to miss work, maybe they have to get a sitter, whatever. So make sure that you are looking at all of those areas so that we can support our client fully. In order to support your client fully, you have to be able to determine what do they need. So assessing your client's support networks and family resources and responses, very, very crucial to their recovery process. Provide education and connect the client with any appropriate resources. Therapeutic communication is a learned art. It is not natural normally to speak to someone very therapeutically, saying things like, I hear what you're saying, can you tell me more? Those sorts of things, but that's exactly what we have to do. Therapeutic techniques include things like active listening, reflection, clarification. What I heard you say was, and then repeat back to them what they said to make sure that there's no misunderstanding. All of these things help to build trust and ensure that the client feels heard and supported, and it will strengthen and deepen your communication and your connection with your client, thereby making them trust you more. Part of therapeutic communication and building that trusting relationship is also creating what is called a therapeutic environment. So making sure that you have a safe, calm environment that supports that client recovery, reduce any distractions, and participate in therapeutic community activities when appropriate, all the while monitoring your client responses to environmental factors. If you see something that is distressing to them, change it if at all possible. It is now time to apply what we've covered. So in this case study, you are caring for a 19-year-old college freshman recently diagnosed with type 1 diabetes. She's struggling with the diagnosis, she's expressing fear and hopelessness, and because of that, she is isolating herself. So let's examine her situation using the clinical judgment model. That clinical judgment model are those 6 steps. If you have already listened to one of the boot camps on the go, you know what those 6 steps are. If not, let me read those or tell you what they are. So step number 1 is recognize cues. Step number 2 is analyze cues. Step number 3 is prioritize hypothesis. Step 4, generate solutions. Step 5, take action. And step 6, evaluate the outcomes. Okay. On this slide, you have a lot of information. I encourage you to take a picture of this slide for referencing on the following slides. On the NCLEX, you will not be able to take a picture, but you will have a dry erase board where you can make notes, and I encourage you to do that. Parts of the scenario will follow through on the NCLEX from slide to slide or question to question, but make sure that you are taking note of anything that you feel like is very important. Step number 1 or question number 1 is recognize cues. In these types of questions, you need to read the information that is there and then figure out what matters. Okay, so you're reading through, this is a progress note excerpt, you're reading through it and you're going to highlight the information that matters. While we can't do that in this setting, I want you to make notes as you're reading through of things that you feel like are important that would be highlighted on the NCLEX especially. Taking note of all of those, make sure that you take a little bit of time to do that before you go to the next slide, because on the next slide you will have the answers. So make sure you are always answering the question before you go on to the answer slide. And here are your answers. So again, there's that progress note, and you were to highlight the assessment findings that suggest that the client is experiencing psychosocial distress. Those things are being tearful and withdrawn, being scared about giving herself insulin. She refused meals twice today She stated my life is basically over and hasn't attended classes and spends most of her time in her room. All of those things say that she is experiencing psychosocial distress. This question is step number 2. It's analyzing cues. So in the first one, you recognize the cues, what is important. Now we're saying, why is it important? In this type of question, you are asked to match the cue, the client cue, with the interpretation. So in other words, if refusing meals and avoiding insulin is a symptom of depression, you match those two. So that's what you're doing as you go down through. You can see that there is one more interpretation than there are cues. That is very typical of an NCLEX question that you might see. You're going to have more choices than you have for matches, but everything only matches one time. So in other words, if you say refuses meals and avoids insulin goes with symptoms of depression, those are now done. You cannot use symptoms of depression again. So again, take your time, make sure that you're matching these up. When you're ready, go to the next slide for the answers. And here we go. Refusing meals and avoiding insulin reflects low self-efficacy or self-esteem. If you're not familiar with low self-efficacy, that term, be familiar with it from now on though, because you might see it on the NCLEX. Statements like my life is basically over indicate ineffective coping. So they're not seeing any way out of this. This is the worst thing that's ever happened to me. That is ineffective coping. Isolation is a symptom of depression. All of these require a psychosocial response. Okay, so it's not about fixing the diabetes, it's about fixing her thinking about the diabetes. Question number 3 then is always prioritize hypothesis. So in question 1, you recognize the cues. In question 2, you analyze the cues. And then in question 3, you prioritize hypothesis. So you come up with what might be going on. As you can see, this is a select all that apply question. For select all that apply questions, turn each answer option into a yes, no, or a true, false statement. Okay? So the question actually is, which of the following psychosocial concerns should the practical nurse identify as priorities for this client? Okay, so you would say things like, should I prioritize impaired social interaction for this client? If it's yes, if it's true, if it's positive, you keep it. If it's no, if it's negative, if it's harmful to your client, you get rid of it. Okay, should I prioritize fear related to self-injection for this client? Again, if it's yes, if it's positive, if it's good, you keep it. If it's no, if it's negative, if it's harmful to your client, you get rid of it. Make sure that you go through all of these answer options just exactly like that, and then check your answers on the next slide. Okay, so this client's main psychosocial concerns are impaired social interaction, fear of self-injection, risk of treatment non-adherence, and risk for impaired adjustment. Okay, so you can see that 4 out of the 6 are options. Do not get caught up on that. If it does not give you a specific number of questions or options to select, it can be anywhere from 1 to all of them. Okay, so yes, you heard me correctly. A select all that apply can have one answer only. So again, you just stick to your rules of answering select all that apply questions. If it's yes, if it's positive, if it's helpful for your patient, you keep it. If it's no, if it's negative, if it's harmful for your client, you throw it out. Okay, regardless of how many you do that on. So you just stick to those rules and don't get caught up on how many are you selecting. Okay, so we have recognized cues, we've analyzed cues, we've evaluated or prioritized a hypothesis. Now we want to generate a solution. So we've identified what's wrong. Now what are we going to do about it, or what can we do about it? This is a drop-down sort of question. You can also look at it as a fill in the blank. Okay, you will see that you have 3 sentences that need to be completed, and you have more options than that. So again, you only use each option one time. So if you say that the first sentence, to address the client's fear of insulin administration, the nurse should use therapeutic communication and validate emotions, you've used that option, you don't use it again. Okay, so only use each option one time to complete each sentence. And here are your interventions. So to address the client's fear of insulin administration, the nurse should, and the option was, provide hands-on insulin teaching with supervision. So you can see all of the correct options are in dark bold print. To support the client's well-being, the nurse should use therapeutic communication and validate emotions. For continued support following discharge, the nurse should refer to college counseling services. Now that we've generated solutions, now it's time to take action. Again, this follows right along with your nursing process where you assess and then you create that nursing diagnosis, and then you come up with a plan, you come up with your nursing interventions, and then you actually do it. So here you are in your case study, taking action. So this says place the following actions in the most appropriate order for the PNVN to perform during this shift. So you're just going to say, what order should you place them in? Okay, very, very important that when you have ordering questions like this, in other words, it's asking you to place the steps in order, that you pay attention to what order do they say. Is it least appropriate to most appropriate? Is it first to last? That's very, very important because you could have them in the right order, but if you start at the wrong side of it, you're going to get the question wrong. Okay, so this says place the following actions in the most appropriate order. So what are you going to do first? That's where you're starting. Okay, so here's your correct order of things to do. Number 5 is first. You're going to assess the emotional readiness and fears. And then you're going to go to number 3, use therapeutic communication to explore the feelings. So you're assessing the emotional readiness and fears. Now I'm going to explore those feelings that they have shared with me. Provide insulin self-administration teaching comes next. You're going to encourage participation in care planning, so further planning. And then lastly, you're going to document your observations and report to the RN or mental health care team. Last question in your case study, same as last question in your nursing process, is evaluate. So you've recognized the cues, you've analyzed the cues, you've generated or prioritized a hypothesis, you generate a solution, you take action. Now I need to evaluate it. So I need to understand, did what I do work? You see the word or the name Vanessa here. That's the name of the client. I know it hasn't been on the previous slides, so that's okay. Don't get caught up in that. So things like that are meant to be just a distraction. Do you focus more on, wait a minute, who's Vanessa? Or do you actually focus in on what you need to be answering? Okay. This is also a select all that apply, but you can see it's called a select all that apply in for number. You know that because it says which 3 findings indicate improvement in the client's psychosocial adaptation. Okay, so Vanessa administered insulin independently with coaching. Does that indicate improvement or decline in the client's psychosocial adaptation? Okay, and you answer all of them just exactly like that. Again, if it's yes, if it's positive, if it helps your client, who happens to be Vanessa, you keep it. If it's no, if it's negative, if it's harmful to your client, you throw it away. Okay, and here are your answers. Administering insulin independently, the client Vanessa spoke with her mother and asked about the student health group. Okay, so that was A, and then B and D. So those are the 3 that you should have chosen. It is very, very, very important that you get very comfortable with case studies. You will have at least 3 case studies on your NCLEX. You may have more than that, but only 3 will be scored for or against you. While it is not completely impossible, it is very difficult to be successful on the NCLEX without answering your case studies correctly. You can see they have 6 questions. Again, you're going to have 3. That means 18 questions off of your NCLEX are going to come strictly from case studies. You have a range on your NCLEX of 85 to 150 questions. So answering case studies is very, very important to your success. Make sure that you read them slowly, carefully, focusing on every word that is there so that you can answer the questions appropriately and correctly. Thank you so much for watching this presentation. It is absolutely a pleasure to get to spend a little bit of teaching time with you. Again, my name is Susan Griffiths. I'm one of the NCLEX Success Specialists. You see the other 3 NSSs pictured here on the screen, Tahira, Jesse, and Christina. Whoever your NSS is, please reach out to me or to them for additional tips and NCLEX readiness, NCLEX prep. Remember, effective communication and emotional support are essential in every client interaction. Reach out to us as you need for follow-up. Thank you and have a great day.